All right, good evening, everyone. My name is Christina Jovanik, and I'm here on behalf of Oakville Hospital Foundation and Halton Healthcare. I just want to thank you all so much for being here with us tonight for the last of Corelife's wellness webinars. So our friends at Corelife have created this amazing webinar series to support women's health and to get everyone ready for our upcoming charity event, the Run for Women by Shoppers Drug Mart. This year, Corelife Wellness has taken the pledge and they've partnered with Halton Healthcare as a local sponsor of the run, which is on May 28th. So for us over at Halton Healthcare, over the last 10 years, we have seen a significant increase in the rate of ED visits and hospitalizations for mental illness in Halton. Women represent approximately 60% of visits to the ED at Halton Healthcare for a mental health or substance use concern. Of those visits, women between the ages of 18 to 24 represent the largest age group using our services, and women over 86 plus are the second largest. I would love for all of you to consider taking the pledge like Corelife Wellness has to walk or run for women's mental health, for your mental health, or for the women in your lives. With your support through this event, we will be able to expand treatment capacity and provide evidence-based services that are more tailored to the unique needs of women and girls in our community. And we will also be able to provide programming tailored to the unique needs of enhancing the capacity of our community-based services. You can find out more about this event at therunforwomen.ca. Now, tonight you will be reviewing how to return to running after postpartum. Sinead, who is our guest speaker tonight, is an associate clinical professor at the Faculty of Health and Science at McMaster University. She teaches and conducts research in both the schools of medicine and rehabilitation science. Her current research interests include conservation approaches to managing pelvic floor dysfunction, pregnancy-related pelvic girdle pain, and interprofessional collaborative practice of models of service provisions to enhance pelvic health. She's authored several clinical practice guidelines related to urinary incontinence with these roles and stays current clinically through her work as pelvic health physiotherapist. Please welcome Sinead.
Perfect. Thank you, Christina. Hi, everybody. So I'm just delighted to be here to be a part of this series for this sort of fabulous initiative. And so thank you, everyone, for coming. So Christina just gave you a great introduction of myself. And what I did also want to say was, in addition to, the role that I have at the university and then the role that I have as a clinician, as a pelvic health physiotherapist, I really did get interested actually in this whole area of perinatal care and women's health, and really sort of the space of postpartum care. Through my own journey after I had twins. And it was really evident to me, even though I had been a physio for almost a decade at that point, that there wasn't a lot of, really good care and guidance for women in this space. And one of the areas that, we still do need a little assistance with is the whole conversation around returning to exercise postpartum, particularly returning to high impact exercise. And what's really, really great is even 5 years ago, still, like clinicians like myself and researchers like myself, there really wasn't much to kind of guide us and to support, the people we were trying to help with really good, solid science and evidence. But in the last 5 years, we've had some more evidence and more direction and more assistance to direct safe and appropriate return to activities like running in the postpartum period. So that's what I'm going to be sharing with you today. So what we're going to go through is, we kind of have to take you right through the perinatal care journey, because a lot of what sort of happens in terms of health status and fitness of tissues pre-pregnancy and through pregnancy has implications for how the birth is going to go, and then has implications postpartum. So we really can't just look at sort of like postpartum considerations. So I'm going to just kind of take you through the pregnancy piece, some of the relevant birth considerations, but then kind of really focus around the principles of postpartum recovery and give you an overview of what we have now in terms of good guidance for returning to running. One of the things, of course, we will kind of land on at the end is an additional piece around urinary incontinence. And, that oftentimes goes hand in hand with pelvic floor dysfunction, because oftentimes, in the postpartum period, it's difficulties with optimal function in the pelvic floor and the whole canister system that sometimes either prevents, women from re-engaging in running and sometimes even walking. Or if we don't have the proper sort of supportive system in place, continuing to run through that and ignoring symptoms can then actually set you up for further problems such as prolapse. So we really want to make sure that at the end of this talk, we talk a little bit of some of that sort of unique, but very, very common and prevalent issue, and then give you some suggestions of some other really great tools to help with that component to get you back to running, of which Corelife actually offers sort of the full menu of solutions there. So let's start with pregnancy. So a little bit of pregnancy 101 here. So when it comes to pregnancy, really every single biological system is affected by pregnancy. So we certainly have sort of some structural considerations, but we also have a lot of physiological changes in all of the different systems in the body. We also know that sort of beliefs and individual sort of beliefs about pregnancy and about birth and sort of about how they should be conducting themselves through this time really are quite strong. They highly predict one's behavior. They translate quite a bit onto one's health status. And a lot of the times they're actually unsubstantiated. So certainly in the work that I do as a pelvic health physiotherapist, is I am really kind of hoping to make sure people are sort of healthy and as fit as can be to sort of go through conscious conception in as much of a seamless way as possible and have a really, really kind of great pregnancy. It's all of these things that we're going to have to kind of consider. It's also important to understand that every single person's sort of journey through this is going to be a little bit different. Every woman's journey from pregnancy to pregnancy and recovery to recovery is going to be quite different. And it's really going to depend on a lot of the factors that I'm going to talk about today. So, I'm going to be presenting to you what some of the guiding principles are, but you'll see that what comes through at the end of the day is each sort of person as they come through pregnancy and postpartum really does need to have an individually sort of tailored approach when it comes to bringing back in high impact exercise to determine, if it's appropriate, when it's appropriate, and sort of what that sort of graded protocol looks like, right? And then another like big take home point is, your way of being when you're pregnant, your way of being when you're postpartum, those are your daily habits, your habitual way of how you show up in the world and what you do. That is going to be like the biggest thing that dictates the state of your health and the state of your pelvic health. Right. So that's also something that's really important and for us to realize. And certainly in the work that I do as a pelvic health physiotherapist, the good bit of my care is kind of framed from a health coaching approach. And certainly that's the approach that's taken with the team at Corelife Wellness as well. So we have now some really great guidelines around exercise in pregnancy. So it's very, very clear that women should be, continuing to be active and exercising throughout their whole pregnancy to be healthy and well. We know that when women are fit and healthy, it's actually much more likely that they have a birth that has less interventions. And we know that interventions at birth actually are highly predictive of pelvic floor trauma and dysfunction. Right? So lots of reasons why we want to be fit. And part of that fitness protocol is engaging in regular low impact exercise. But part of that recommendation is starting to engage in exercise that is really intentionally connecting and engaging the pelvic floor correctly. So really good science there. We certainly used to have thinking around, was exercise going to be too strenuous? Would it potentially perpetuate miscarriage and some of these, previous beliefs? But that has all been disproven. We know that definitely people do much, much better when they're fit and healthy. And certainly we need to be giving women lots of options so they can choose what they're interested and motivated in. So that's important. And when it comes to the birth, I mean, how a birth goes down oftentimes will dictate how smooth the recovery is and how long the recovery takes. So, every single person isn't going to sort of be the same postpartum. Gone are the days of using timelines as a stamp of, oh, at 6 weeks postpartum, that means everyone gets a green pass to do this, right? We actually see in the system that has equated essentially to medical negligence. And we've seen a lot of, issues, because of that thinking. And really, it's going to depend. It's going to depend on, physical trauma, emotional trauma, how disturbed sort of the physiologic systems were, for a variety of reasons, but a big one being even how much support does that individual have in that postpartum period to even be able to sort of recoup some of their systems for recovery. So these are some things that we have to think about. Being a little bit more specific, some of the obstetric factors that have been shown to impact the state of the pelvic floor, dysfunction, and thus global pelvic health is, the choice of your provider and birthplace. Interestingly, that actually dictates much more than any other factor if you're going to come through your birth with an intact perineum or not. Really highlights where some social factors are much more important than other factors. And this is something that women often don't think about, even though many of the women that I see are very motivated. It's very much a goal of theirs to not tear in their birth, to have an intact perineum. But what we see is that providers who have a high rate of perineal tearing, have a high rate of episiotomy use, et cetera, that's actually much more predictive that that's going to be your outcome compared to any other factors. That's important for people to know. Certainly some of these other sort of standard and unfortunately here in Canada, routine interventions, they don't fare so well for the pelvic floor. So use of epidural analgesia, Pitocin, any of these sort of operative procedures, episiotomy, vacuum forceps, those all fare poorly for the pelvic floor. Using a doula actually translates to a major positive benefit to the pelvic floor, much more likely that you won't sustain a cascade of interventions if you have a doula, much more likely that you're going to come out with an intact perineum. And then as far as birthing positions, the more standard birthing position of lying on your back or in semi-sitting is actually correlated with pelvic floor trauma. Whereas, other birthing positions such as high kneeling or side lying are correlated with much higher rates of an impact perineum or no pelvic floor tearing. When we are pushing baby out, being coached to hold your breath and push the baby out, which again is more standard protocol here in Canada, that's actually correlated with much higher rates of injury to the pelvic floor, whereas having the back of the throat open and sort of more using your breath and kind of following more of a spontaneous pushing style, that's actually correlated with a pelvic floor that is much more intact and less pelvic floor dysfunction. And then a birthing environment that is dark and calm and really enables the birthing person to feel safe and unobserved. That correlates with better pelvic health outcomes versus an environment where there's a lot of noise and bright lights and people coming out in and out of the room, et cetera. So these are all things we kind of have to be thinking about. If really our goal is to have women coming through the other side after they birth their babies, being able to recover well, re-engage in the exercise that they love, that is good for their physical health and mental health, we kind of have to put some better birthing practices in place for sure. Because, what do we know? We know that high impact exercise is correlated with more pelvic floor dysfunction. So it really isn't a surprise that, women's activity levels across the board go down after they've had children. And certainly this issue around the pelvic floor not being able to manage the loads of these activities is definitely one of, the reasons why women are steering clear for these things. And when we have so many excellent sort of conservative care options to really get the pelvic floor back on track, it really is unfortunate. And that's all of our duty to be aware, of, what we need to look out for. When are these activities appropriate? When are they not? And if the pelvic floor dysfunction is standing in the way, where can we get help? And what do we need to do about that, right? We know that bowel health is really correlated with bladder symptoms and pelvic floor function. So that's another thing for everyone to really be aware of. We're having sort of chronic constipation and issues with the gut and the back end. That consistently is predictive of a pelvic floor not working well and a bladder becoming overactive and not working well. We know also that pelvic organ prolapse is a scenario that happens, in that postpartum period, usually not immediately. Usually it takes a little bit longer to kick in, but certainly this is a scenario that will be aggravated by high impact exercise. If that exercise is instituted when the pelvic floor and other structures aren't working properly. And we know that pelvic organ prolapse is correlated with another common postpartum situation, which is diastasis rectus abdominis, which is essentially like structures prolapsing out the ventral front of the abdominal wall rather than down sort of into the pelvic floor. And as I said, certainly 6 weeks postpartum, we've sort of handled that as, the magic green light timeline for everyone's life to go back to normal, but it really doesn't work that way, right? Certainly we know that, even in the best of scenarios, when there wasn't sort of extensive tearing or really forceps use or some other things that we know are highly, highly correlating with pelvic floor trauma, even in the best of a scenario, we know that that pudendal nerve stretches enough through that process of birth. And the studies that we do have show us that the full tensile strength of the pelvic floor is not restored, even in the best of scenarios, by 6 weeks postpartum. Right. So we really need to kind of rethink some of the practices that currently go on. This is a study that was just published a couple of years ago that I just wanted to highlight because, in fairness, I think when it comes to urinary incontinence, CrossFit has kind of had a bad rap, over the last 5-10 years, certainly in the time that I have been really specialized in this area. But actually what we see is that running is really a lot harder on that pelvic floor than CrossFit. And I think because running is so accessible, it's something that's so familiar to people, it in many ways feels very benign. There sometimes can be this thought of, oh, well, I'm 6 weeks postpartum. I've been, getting out for walks with my baby. Maybe I'll just kind of start running, and maybe I'll even start running while I'm pushing the buggy. And that can feel quite benign to someone. But actually we see there's higher prevalence in all these pelvic floor disorders with running compared to CrossFit. Running actually imposes huge, huge ground reaction force and really requires an incredibly robust sort of pelvic floor. So it's just important for us to be aware of that. Certainly in the postpartum period, we have our very acute stage of recovery. That's kind of the time that someone would be monitored either at home by their midwife if they birthed at home, or in the hospital, the time that they would have to stay in the hospital before being discharged, just because there's all kinds of rapid recalibration of all their biological systems trying to get to sort of that state of, homeostasis. And then we kind of have that subacute stage, which takes us up to about that 6-week point, right? And that's usually when people are checking back in with their primary healthcare provider. But then we very much have this delayed established recovery period that goes right up to the first 6 months. Many, many women are breastfeeding exclusively in this time. And there's kind of slow, gradual recovery of all the different systems. And it very much is a time of restoration for the connective tissue. And certainly, we have really good, consistent data collected from US Army soldiers that indicates strength impairment remains. And these are super, super fit women, right? So these are women that went into pregnancy with a very high baseline of fitness, which is not the normal population, certainly that I see, right? So probably even the status of the people I see wouldn't even be as good as what I see in these studies with these super fit women going into pregnancy. But we see that there remains a strength deficit, like the strength is not fully back to normal in both the pelvic floor and the abdominal wall, even by 6 months. So these are just some things that we need to kind of think about. And we need to think about in that postpartum period when we're bringing exercise back in, that the style of exercise, the intensity of exercise is going to depend on a whole bunch of things. It's going to depend on that pre-birth fitness or the pre-birth health status. It's going to depend on the birth, and how that went down and what interventions were used and what type of trauma physically and, emotionally was experienced by that person, because all those things impact recovery. It's going to depend on the current physiological state of that person. So someone who has, a ton of extra support, or, they're just sort of in an operating rhythm where they're really able to kind of rest when baby rests, and baby's doing well. So baby is actually sleeping quite well through the day and getting kind of longer chunks at night. Well, the state of their physiologic systems is going to be very different than the individual who was struggling with a baby who had a tongue tie and wasn't breastfeeding properly and wasn't napping and you're kind of hypervigilant all around the clock. I mean, the status of your physiologic systems in that situation is going to be very, very different, right? So these are all things that we have to keep in mind. Generally, a principle that goes across regardless of where you're starting, we still always want to start with sort of reduced intensity and a reduced length of any type of exercise, right? So that's really important. It's also important, that just as we have really good evidence that we should be kind of connecting and engaging those pelvic floor structures through pregnancy to give us better outcomes, we want to start engaging those structures right after we birth as well, because pumping the pelvic floor, and ideally we're pumping that in as coordinated with our breathing diaphragms. We're not necessarily doing sustained holds, but, as we're exhaling, we're lifting up that pelvic floor, and as we're inhaling, we're letting go, because that's what's actually going to stimulate nerve regrowth factor for that pudendal nerve, right? And so that's going to be really, really important. It's important that people understand to self-monitor and really listen to their body. And if they're doing a movement where they have pain, then they need to stop doing it. If they're doing a movement and they actually start leaking, there's like a mechanical failure in their body, they need to stop. If they're doing a movement, they're feeling a lot of pressure, something doesn't feel right, these are all signs to stop, and these are all signs to kind of get help. So that's really important. One of the problems is that we've been very conditioned in our society to normalize some of these issues, to normalize leaking in the postpartum period, for example. And there's some messaging around, just pad up and play on. And that can actually have pretty deleterious effects when it comes to other structures that require support in the pelvis that, we're then potentially causing some trouble to as we're, pushing through. We don't have a ton of really specific, well done studies based on really good evidence around postpartum running specifically, but we certainly have 3 recent ones, and many of which are kind of actually found the same types of things. And really what we see is even the technique of running and some of those sort of aspects of running postpartum, we notice that we have less trunk rotation. We don't have the same activation through the trunk. We have some sort of hip flexor sort of deficits. And so, thinking about where these mechanics might have got programmed, especially if people were continuing to run when they were pregnant, or even how they're starting to walk and move, we're not able to really rotate well through our trunk when we're pregnant, right? And so it's important too that, in this postpartum period, not only are we making sure the pelvic floor can handle, the running, not only are we making sure that all the physiologic systems are at a good state to handle a task that is depleting on the energy system that pumps extra cortisol and adrenaline through the system, but we're also thinking about intentionally trying to bring things like trunk rotation back into the form, because those are all going to be, aspects to the form that are going to create better synergy in the whole system, including the pelvic floor. So that's something that we have to be thinking about. And certainly, if anyone's struggling with returning back to exercise in the postpartum period, they really would be wise to connect, with practitioners such as those who are at Corelife Wellness, with another sort of pelvic health or women's health physical therapist, for example. So I already kind of indicated that there's quite a lot of ground reaction force, almost sort of 2.5 times someone's body weight, right? So that's important to be aware of. It's also important to be aware that high impact activities such as running is associated with sudden rises in intra-abdominal pressure. And that can be quite problematic if we have a deep core system that isn't able to counter that pressure and isn't able to manage it well, right? And so in scenarios where we have pelvic organ prolapse or really severe incontinence or diastasis, that's always one of our goals, is to try to be getting the system robust enough that it can really sort of manage pressures. And until it can manage pressures, we don't want to be sort of over challenging the system with pumping too much pressure through it. So that's certainly something we need to be aware of. And we do know that, you know, there is really a lot of reason why we want to consider that pelvic floor status. We don't know how much force through that lower limb is actually absorbed in the pelvic floor. But we do see for many, many women, even if they don't have incontinence with anything else, if they try to run, that's when that deficit in their pelvic floor will be made very, very clear. And so we certainly know how important it is for the pelvic floor to be functioning really, really well when we're wanting to get people running again. So as I said, we now have some better guidance. This was from a consensus study coming up with some recommendations. It was published, I think, in 2020 in the British Sports Medicine Journal. And so really what we have some consensus on is that, you know, all women who are returning to running, they really need to have an individualized assessment and guided pelvic floor rehabilitation. So that's key. Like that's first on the list, right, for returning to running. And the second thing that's really important is the timeline, sort of that minimum that's been put forward is a minimum of 3 months. So no one should even really be attempting, you know, even the most fit person who had the greatest birth and their perineum was totally intact, because of all the different things that are recovering, really no one should be attempting to return to run until after the 4th trimester, until after the first 3 months. And then at that point, provided that they have, you know, adequate sort of parameters of function on their pelvic floor, provided that they have adequate sort of parameters of impact-based testing, which I'll take you through in a moment, and provided, you know, their physiological systems aren't showing major sort of deficits or red flags, then that's when they could try running, would be at that 3-month timeline. So many people will kind of ask, well, then what am I doing? If I can't run until 12 weeks and beyond, then what? So what's really great about the guidelines is it integrates an infographic and gives really great suggestions of what are some of the things we can be doing at 0 to 2 weeks, right? Getting the pelvic floor kind of gently going again, getting back out for your walks, and then progressing on to other forms of lower impact exercise, other forms of sort of gentle sort of strengthening and other types of core exercises, and then moving on to those harder, more higher impact things at 12 weeks and beyond. So again, just to recap, like what are some structural things, you know, someone like myself, if I'm interfacing with a woman and we're trying to get her ready to sort of be back to running or other high impact activity that she wants to start engaging in. So, you know, I'm thinking of alignment. What's the relative alignment between her rib cage and her pelvic floor, and how does she normally want to be, but how does she want to be when she is in her position to exercise or run? Certainly, pelvic floor status is really important. We want to make sure the range of motion is full for sure, meaning it is not held in a bit of a higher tone, hypertonic state. You know, we need full relaxation, full ability to contract fully, that full range of motion to generate the most amount of power. We also need the pelvic floor to be automated and responsive automatically, right? So when someone coughs, sneezes, moves, lifts their arm, in response to all of that, the pelvic floor is meant to automatically lift and close. And it's important that that automated mechanism is really built in when we are thinking of putting demands on, such as running. Again, checking the status of the diaphragm and breathing. The diaphragm is best friends with the pelvic floor. So it's important that we're making sure those two structures are working really well. And then again, coming back to some of those pieces that I mentioned, how well is intra-abdominal pressure being managed? Trunk rotation, are we really stiff through the trunk? We're not really rotating there very well. That's automatically going to sort of augment in a negative way the strategy for running. And then scar status, because cesarean birth is very common. It's 30% here in Ontario. And certainly when we have a lot of restricted tissue at the bottom of the canister, at that lower part of the anterior pelvis, that impacts load transfer through the abdominal wall. That impacts intra-abdominal pressure management in a negative way, actually, until we kind of have that scar more malleable. So these are all things structurally we want to think of to set someone up for success when they're getting back to running or other high impact activity. This is the load and impact assessment that's suggested in the clinical practice guidelines, again, that we would take someone through. So, we want to make sure someone can walk for 30 minutes, no problem, no pain, no leaking, no pressure, no problem. We want to make sure that they can do a single leg balance test for at least 10 seconds to kind of have some sense that their system is robust enough to take on anything higher impact. Single leg squat for 10 repetitions, jog on the spot for 1 minute without any issue, right? No leaking, no pressure, nothing like that. 10 forward bounds. Those are kind of like those big hops. Hop in one place for repetitions of 10. And then single leg sort of running man for 10 repetitions. Okay, so we, have some nice guidance for some testing of the pelvic floor, testing of intra-abdominal pressure management, and some of that lower kinetic chain style testing. But that's only part of the equation. We also really need to think about the physiologic systems, and much more has been written about that recently. There's this excellent clinical commentary that was actually just published a couple of months ago, speaking in detail about all of these issues: deconditioning, fear of movement, nutrition, sleeping patterns, breastfeeding status, relative energy deficiency syndrome or status, and sort of mood, right? And so again, on the topic of mental health, oftentimes in this postpartum period, we really can get a big intersection of mood being altered because of depletion and just simply energy depletion, nutrient depletion, right? That is one established mechanism for reduced mood or increased feelings of anxiety, right? Because depressed mood and anxiety are sort of like outputs from our immune system, essentially, right? And, we also can have disruptions in our mood from our stress response system sort of going and not having enough time in the parasympathetic side of our nervous system. And that's another thing that's actually quite common in that postnatal period, is women not having enough support, not enough help, and they're kind of going around and their cortisol system. And then we can have other influences in terms of the rapid drop of progesterone and estrogen right after the placenta is born. And sometimes the system not really being able to calibrate with that, and sort of with that relative drop in estrogen and progesterone, then that impacting sort of lower mood. And certainly, engaging in movement and exercise and being outside, these are all things that would be supportive for this. But women, of course, are going to need some guidance here, right? This is just a nice algorithm to kind of map out a couple of the things that I just said, right? So, if we sort of have a maladaptive response to any type of stressor, maybe we're stressed about anything a woman could be stressed about in that postpartum period, and it could be a list of about 200 things, right? We get sort of a maladaptive response to that stressor or perceived threat. That will actually kick the system, the hypothalamic pituitary adrenal axis, that's our stress response system, into overdrive. We'll get this sort of excessive prolonged activation of that system, which will dysregulate cortisol, which is our main sort of stress response hormone, which will lead to inflammation, that dysregulation of the immune system that I mentioned. And then predictably, that's going to spin off on our survival outputs. So pain is a survival output, depressed mood is a survival output, fatigue is a survival output, anxiety is a survival output. So those are all the different survival outputs that can manifest in response to this, right? So we really want to make sure, especially when women are wanting to engage back into activity and running, if we're thinking that a woman is already in this excessive activation of their stress response system, then engaging in a form of exercise that pumps a lot of additional cortisol and adrenaline, like running, probably isn't appropriate, even if on the structural side of things, everything's good, right? That's when we would want to engage in a lot more restorative movement, right? So it's understanding sort of all these pieces and really sort of guiding someone back to the best type of movement for them, with a goal of eventually, once the systems are normalized, getting back to the running. So really, to nourish these physiologic systems, I mean, we need good nutrition, right? And more physiotherapists and my colleagues are being called to up their game in this area. So what's recommended, which is really similar to general recommendations for good, healthy diet to support a good, healthy, diverse microbiome that will support a really good immune system and endocrine system, right? So it's really no different. But I would argue it's almost even more important for people at this critical time in their life to even be more attentive to this. But a Mediterranean style diet, right? And really making sure that we're thinking about things like tissue healing and collagen synthesis, and understanding that, okay, well, yeah, one of the reasons why we might want to have a whole variety of different colored fruits and vegetables is you're going to get all the different colored polyphenols to feed your microbiome. You're going to get all the different types of fibers to feed a healthy microbiome that's going to drive better biological systems. But also, you're going to get lots of vitamin C, and vitamin C, of course, is a precursor to collagen. So that's important. And then, I mean, globally, when we're talking about pelvic health and in general, anytime we are in a scenario where we're carrying extra weight, that always fares poorly for pelvic health, right? So that's like another reason just why we want to think of having nutrient-dense food that's going to be very supportive to our systems. Now, on the other side of that is getting enough sleep and rest, because that, of course, is when our body repairs and when tissue repairs, right? So those mamas who we're seeing who really were not able to kind of progress them along, consistently, usually they're the ones that aren't getting any sort of reparative sleep at night. They're kind of spinning their wheels and they're still trying to push themselves to do exercise and go to the gym, but those exercises aren't even really developing very good fitness capacity because there's no restoration at night. So that's another thing we have to think about. So sometimes it's really, at the very least, emphasizing trying to get at least an uninterrupted window between 10 p.m. and 2 a.m. when that physical repair sleep is really going on. And then even helping people to at least understand why their progress is so slow, to kind of better set their expectations, right? So they understand that sleep loss impairs protein synthesis, impairs muscle strength. Like, we cannot develop fitness if we're not even getting like the basic building blocks of sleep, right? And then sometimes too, mamas get into a scenario where they've been up with baby for the first 6 months. Now baby's sleeping through the night, but they themselves has dysregulated their cortisol, their circadian rhythm so much that they need to get themselves back on really good hygiene practices, right? So we're talking about getting good light exposure, natural light exposure first thing in the day, getting out for that morning walk, limiting that blue light and screens in the evening, making sure their sleep environment is quiet and dark and cool, and being mindful of caffeine consumption, right? Not taking that sort of too late in the day. So just kind of wrapping up towards the end, because we kind of have expert-based guidelines, a consensus, we also have a couple of actual studies. But really, we do at this point have more expert perspectives. So I'm just pulling out some of the expert perspectives that are out there. So we have kind of some more salient kind of takeaways for everyone. So it's really around thinking, and when we're getting back to running in the postpartum period, it's about thinking of the concept of rebuilding, right? So that's really important. It's not just, oh, we've had a timeline and now we can just magically go back to what we were doing. No, it's definitely like a building process. What are some of the strategies that are really put forward to start to get ready to run? It's doing a lot of hill walking. When we're walking up a hill, it automatically kind of forces our alignment almost into more of like a skier stance. And that's the very stance that seems to best align the pelvic floor and the diaphragm and the whole system to really synergize well. So that can be a really great strategy. Doing intervals. So maybe walking for 5 minutes and just running for 30 seconds or running for a minute. And then doing some work at the wall. So rather than kind of standing and doing some jumping jacks, going at the wall, so you're not fully upright, you're taking off some of the load off the pelvic floor because you're on an angle and kind of doing like wall jacks on the wall, for example, right? Women also oftentimes want to brace when they run because they kind of have a perception that they're more together. That's actually a really, really poor strategy, right? We want the opposite. We want everything sort of automated, and we want the trunk and everything to be able to move well. So if anything, oftentimes we actually have to address excessive tension through the trunk and through the hips and pelvis, and really condition women to be able to just allow that automatic motion to happen, right? As I mentioned, trunk strength and rotation are really, really important. They're really, really important for running in high impact. And those are also things that are really, really important for us to actually recover a diastasis rectus abdominis. So we kind of see where those two things are going to line up together, right? So yeah, we really want to make sure the strategy they're engaging in matches the task, that they're not sort of trying to put too much effort to sort of brace if it's sort of more of an easier task, right? It's less about timeline, more about principles. It's all individualized. And it's really important that women need to sort of be able to self-monitor their own readiness, be able to kind of monitor, oh, I just leaked with that, or yeah, I'm noticing I'm kind of in a habit of peeing before I leave the house to run. So obviously I'm not feeling enough trust in my system that if my bladder was partly full, that I wouldn't leak. That's really important. You know, if your system is ready, you should be able to run on a partially full bladder. It's a very destructive habit to defensively void and pee ahead of workouts, right? So women need to be able to self-monitor and understand and hopefully be working with people who are going to make them feel empowered. And it's really more about the systems, including the pelvic floor, as being smart and responsive and being able to sort of adapt and respond rather than just being strong and stable, right? So we kind of have to get rid of that concept of strong and stable and bracing and more around smart and responsive and healthy and fit, right? So what happens when we're at that point and really it's evident that the issue is the pelvic floor? The pelvic floor just needs more help. And, you know, these are women who really, they don't want to wait for months and months and months until the pelvic floor slowly gets better and better. You know, well, we have lots of other tools beyond individualized pelvic floor muscle training that are really well substantiated and recommended in the best practice guidelines. So we have intravaginal devices like the Uresta, that it's to the right here on the slide. We have external supports, so like shorts that go on with patented technology sort of in the perineum area to provide some extra proprioceptive support and enhance recovery. And then we have forms of electrical muscle stimulation that can really get that sort of neuromuscular re-education on track much, much quicker. Our more novel forms of electrical stim to the pelvic floor is high FEM technology, high intensity focused electromagnetic therapy. And that's, of course, one of the fabulous tools that Corelife has. And really, this is electrical muscle stim that goes right into the pelvic floor, but it doesn't require it to be inserted intravaginally. You sit on this chair fully clothed. the energy comes right up through your pelvic floor. And the studies so far have been showing that it's actually much more effective than the previous forms of stim. So, I mean, we have lots of different tools and options if it is in fact the pelvic floor standing in the way, to get around that so we can still keep people running and walking and being fit. And that is all I had for you today, but I'm happy to take any questions.